Good morning, students. So, welcome to Community Health Nursing. Last class we have seen about imnci. So, continuation of the class. So, as I told, in imnci, 8 categories are under two divisions, two categories, that is 0 to 2 months and 2 months to 5 years. So, now let us see how the assessment of sick child and management that is done from 0 to 2 months of age. First one is possible bacterial infections or jaundice. Second, have to assess for the infant with diarrhea, feeding problems, immunization status. So these are the four things. Major health issues and morbidity and mortality are more with these issues, related issues. So it is very important, sir, that these four issues must to be taken into consideration, and imnci has to be implemented in this aspect. So coming to that, so based upon bacterial infection, that is, we know that pink, yellow and green are the three color codes. Green is the home management. So if there is a bacterial infection, surely the patient has to be in the hospital or in OPD treatment. In home based treatment is not allowed in case of bacterial infections. Okay, so only pink and yellow is the management process. So if there is a possible bacterial infection, the patient or the child will show the signs like convulsions, fast breathing, chest indrawing, nasal flaring, bulging of the fontanelle, pus draining from the ear, umbilical redness, fever, and severe skin pustules, lethargic, unconsciousness, less than normal movement. So these are the common signs and symptoms which can indicate that the child may be with possible bacterial infection. So in that cases, first we have to provide IM antibiotics and treat to prevent low blood sugar. Advise mother to keep the infant warmly on the way to hospital and refer urgently to the hospital. So immediate hospitalization and referring to the hospital with advanced technology. First referral unit the child has to be referred to. So that is what happened in the pink, and that is in case of possible bacterial infection. That is, next one is local bacterial infection. The child may have signs and symptoms of red umbilicus or draining pulse or skin pustules. Then we can suspect the child may be with local bacterial infection. In that case, oral antibiotics. Teach the mother to treat local infections at home. Advise mother to give home care for the young infant, follow up in 2 days. But surely the child must be on oral antibiotics. Okay, so that is most important. If the infection is severe, then this is again the same table, little more advanced they have shown. So if it is a severe case, surely we have to take the child to the referral. If it is a local infection, with the antibiotic follow-up is enough. If it is severe, if it is not a infection, unlikely, there is no signs of infection, then you can take the child to home. So advise the mother to give home care for the young infant. It may be because of some other reasons, there is nothing to worry. So all these are things. And then comes jaundice. If this is severe jaundice, usually the skin and soles will be yellow, eyes and skin will be yellow, and our treatment modality is treat to prevent low blood sugar, warm the child, and always check the temperature frequently. Advise mother to keep the child in warm temperature and immediately refer to the hospitals. Only skin or eyes yellow, jaundice. Advise, if suppose it is a type of jaundice, there is no need, it will get on by itself, there is no need to get hospitalized, then they can take the child home. Advise the mother to have a follow-up after 2 days. So that is about bacterial infection or jaundice. Next is about in case of diarrhea. If there is a blood in the stool, we can say that is a signs of dysentery. Usually the child may feel lethargic, restlessness, sunken eyes, skin turgor is become poor. So in that case, we have to classify based on the type of dehydration. Sometimes the child may land to dehydration. So severe or few dehydration or no dehydration. So that way we have to see for it. So this is a table showing how to manage if child is having severe diarrhea and landing up with severe dehydration. These are the two signs we have to keep in mind if the child is having severe dehydration, that is movement only when stimulated, or no movement even when stimulated. Sunken eyes, skin pinches, go backs very slowly. You know this, right? How the skin, you can see usually we are doing the skin turgor checking in the umbilical area to get accurate result. Even in the palms also usually we see, but most common in babies we are checking in the abdomen. So if the skin is not returning back, it takes more time, that means there is a dehydration. So that then we can say that the child is in severe dehydration. Immediately IM, ampicillin or gentamicin has to be provided. Child has to refer to the hospitals, provide ORS, breastfeeding and IV antibiotics if necessary, and weight has to be checked on regular basis. Then if there is some dehydration, the child may show restlessness, irritable, sunken eyes, skin pinch, go backs very slowly. In that case, the child has to be taken to the hospital, provide ORS, advise the mother to give breastfeed, give fluids and antibiotics are provided, and ask them to give more of fluids and follow up in 2 days. If there is no signs of dehydration, then that can be managed at home. The child can be taken to home. Advise mother to return immediately if the condition worsens. Follow up in 5 days. Give fluids to treat the diarrhea. If there is severe persistent diarrhea, if diarrhea lasting 14 days, then immediately refer to the hospital. The patient has to be on IM injections and patient has to be hospitalized. If there is a blood in the stool, that is dysentery, then the patient has to be on IM infection, blood sugar has to be checked, and the child has to be in a hospital situation. So that is about diarrhea and dehydration. Next is about feeding problems. If the child is having feeding difficulty, or if the infant is breastfed properly, if the child is not having good sucking or good attachment, then there is a chances of possible bacterial infections, or we can say it is a feeding problem. Then the child has to be taken to hospital. Teach the correct technique to the mother how to feed the baby. Reduce other feeds. No milk. Give cow's milk. If the child is that old. Now the child is only 0 to 2 months, so we are not advising the cow's milk. Other than that, if the child is not taking milk, or the mother is having no ejection of milk, then the child can be on formula feeding. Does the mother have pain? Suppose if the good attachment is not there, suppose there is a crackles in the nipple or sore nipple, engorgement, white patches on the nipple, then also inadequate feeding will happen. So in that cases also formula feeding has to be given, and motivate the mother to give breastfeeding, and management has to be taken to manage the engorgement and sore nipple. So this is about 0 to 2 months. Next coming assessment of young child 2 months to 5 years of age. So these are the things that to be assessed: general danger signs, cough, breathing difficulty, diarrhea, malnutrition, anemia, immunization, mainly vitamin A, iron and folic acid supplementation. Okay, if there is any respiratory issue, this is a common 2 months to 5 years is a peak period in which the child may land up with frequent respiratory infection. These respiratory infections sometimes can lead to pneumonia and very other severe diseases. So based upon the child signs and symptoms, like if there is a chest indrawing, stridor in a calm child, then immediately the child has to be taken to the hospital and antibiotics has to be initiated. Then if there is a fast breathing, then also the child has to be taken to a hospital and give cotrimoxazole for 5 days, soothe the throat and relieve the cough with a safe remedy. Advise mother to return immediately, follow up in 2 days. So OPD based treatment is enough if there is only fast breathing, but the mother and the family member must be vigilant to prevent exposure to cold climate or cold food, dust environment. So all this has to be prevented. Keep the child in a warm environment, safe environment. Always monitor and see that medications has to be taken regularly. Breastfeeding has to be provided. Sometimes it may be only cough and cold. There is no signs of pneumonia. Then home-based treatment is enough. At home itself, the child can be managed, that is by breastfeeding, so soothe the throat and relieve the cough with a safe remedy, and follow-up can be taken. In case of diarrhea,